Imagine you've set a goal to run a local 5K race, then awaken for your training run, unable to feel your left leg, falling to the ground, unable to walk without assistance. Imagine you're a new mom holding your baby, and suddenly you lose vision in your right eye. Panic that your left eye will go next. Now, picture being in the prime of your career only to wake up unable to remember the name of the client you are set to meet with. This is multiple sclerosis, an unpredictable, degenerative, and inflammatory disease that attacks the brain and the spinal cord. It affects movement, vision, memory, and most profoundly, a person's sense of identity. Now, at the heart of this identity disruption lies something essential, and that's purpose. How purpose acts like an anchor. It provides stability and uncertainty, it supports adjustment, and helps people see themselves not only as patients, but as whole human beings. Now, thanks to advances in disease modifying drug therapy, we can slow physical disability. But no drug can answer the question patients often ask: what's the point of going on like this? Because MS disrupts more than the body by creating a gap where meaning and purpose can slip away. Yet in MS care, we rarely help patients rebuild that purpose alongside physical treatment after diagnoses. That's why my dissertation tests a nurse led, group based intervention specifically designed to help people with MS explore meaning and purpose in their lives. Now, nurses are uniquely positioned to deliver this care at scale, given their accessibility compared to traditional mental health services. Over 6 weeks, participants engage in structured sessions where nurses guide conversations, reflections, and strategies to build a new purpose in life statement and a new trajectory. We measure outcomes such as meaning in life and quality of life. Now, research shows that purpose isn't just a nice to have, it strengthens resilience, improves mental health, and can reduce inflammation across the body, which can have an incredible impact on an inflammatory disease such as multiple sclerosis. People with a strong sense of purpose live longer, recover faster, and experience a better quality of life. Now, if successful, this program could transform how nurses address the invisible side of MS. More than 2.8 million people worldwide live with this disease, most diagnosed in the prime of life when careers, families, and futures are still being built. Now, MS is just one disease, but its lessons are universal. Illness in all forms does more than damage the body, it disrupts meaning and purpose, which means helping patients reconstruct purpose extends far beyond MS care and can be used in any condition where the question shifts from how do I survive to why do I keep going? Thank you.